After you deal with any first aid emergency, but particularly after CPR and AED use, you'll experience some form of emotional response. The whole episode can leave you feeling overwhelmed, and it can cause you to doubt your own expertise as well as what the outcome would have been if you had dealt with things differently. Post-traumatic stress disorder, or PTSD, affects different people in different ways, and it can last for hours, days, months, or sometimes even years after the event. Common ways it can affect people include flashbacks, nightmares, panic attacks, depression, fear, stress, having a short temper, personality changes. They may also change the way they act, and they may avoid situations that remind them of the incident. There is some guidance on post-traumatic stress disorder given by the Royal College of Psychiatrists, and we've put a link on the Pro-Training student dashboard area. Some of the ways they recommend you can help yourself or someone else include talking to a counsellor about what's happened, or talk with a friend, doctor, family member, or someone at work. Try to keep your life patterns as normal as possible to avoid letting the problems take over your life. Go back to the area where it happened and talk to others who were there if possible. Take care when getting about, especially when driving if your concentration is affected or distracted. And finally, relaxation and exercise can help. If the issues become too overwhelming to handle, talk to a medical professional. When you deal with any medical emergency, you can only do your best, and it's not possible to change things after the event. The important thing is that you actually helped this person. All anyone can ask of you is to do your best. Feel good that you got involved to help the person. In many cases, people simply cannot be bothered and they don't help at all.